lot of educational programs had a very tough time during COVID, testing the doctors and making sure that everybody was safe. So there's a lot more limitations back then. That's obviously loosened up a little bit more. But we found that the most important part is keeping our community together, keeping the FMR education going, and making sure that they have a resource when they need it. FMR is here not only for the dental professionals, but it's also here for students and residents. The young dental professional right now is faced with a lot of stress, a lot of financial stress. They don't know where to go to work. I think that the dental student needs to see the outside part of dentistry, the reality of dentistry. They're honed into a dental school. The residents are honed into a hospital residency, and they haven't really got exposed to the real world. So FMR is trying to keep that link together. Give a handout to them and saying, hey, there's after this residency, after your dental school, there's something else. One of the strengths of FMR is having the faculty that have their own practices. So they're doing the dentistry every day. We're not a full-time education facility because we want to keep our hands wet. We want to keep our hands doing the techniques that we've learned. Dentistry needs to be taught in a positive way with leaders and doctors who really know and understand treatment planning, occlusion, aesthetics, implants, how to really bring that all together in one really comprehensive course. A lot of doctors had emotional issues. Me, myself, I had a lot of trauma, and I think it's a real issue that has to be discussed. So keeping the lines of communication open through Zoom meetings, through online meetings. It's been very difficult for some of the dentists who were just starting their practices right before COVID and all of a sudden couldn't practice or lost their patients or couldn't go to their offices. So we have a lot of dentists who financially were in a very difficult situation. We've reached out to them. We have outreach programs to those doctors. Now they're looking for jobs. They're trying to connect them with other people that may have a need to hire them. With our younger doctors, they need to be able to reach out to us and say, hey, I have an issue. I need to talk to you. Let's do this together. I think there has to be a connection and that they have a safe zone to learn in with no judgment, and we're teaching them in a positive way. And FMR is providing that for them. And if they need to reach out, they know they have someone here for them. And that's one of the few things that happens at FMR that really doesn't happen anywhere else. That connection of that family type of education really kept us going in FMR. And even now, going into the fall, we're really focused on bringing back the patients and the doctors so they can actually treat the patients in a really comprehensive way. And I believe that FMR has always been there for them through the difficult times. What we always aspire to is to have, again, support systems that help them understand how to become more successful, how to learn the business part of dentistry, but also not to fall into the pitfalls of spinning your wheels and running too many hours and then not really becoming the dental professional that you always wanted to be.